My name is Dr. Chad Woodard, and in collaboration with the Global Healthy Living Foundation, we're presenting a series of videos specific for people living with rheumatoid arthritis for gentle, progressive mobility and stretching. Today's video is going to start with the neck, the cervical spine. I'm going to take us through just a few very simple and gentle yet effective exercises that I prescribe to all of my patients with rheumatoid arthritis to get them moving their best, to get their joints as functional as possible. Anything that we do today, please modify to your own abilities. If I'm asking you to do something that's causing a severe pain, a pinching feeling, a sharpness, a stabbing, just back off, maybe do a little bit less, modify as you need, or just skip the exercise altogether until your body's ready. I'll take us through just a few simple exercises. The nice thing about these is you can do them first thing in the morning and they really get everything moving. The first exercise is just called a neck retraction. If I turn to the side, what a lot of my patients with rheumatoid end up getting is kind of a stuck forward head position where the joints in their cervical spine are closed down and very stiff and crunched. So this first exercise is, I want you just to gently open your chest and pull your shoulders back just a bit. And from here, I want you to think of your head sliding backwards. When you do that, you might feel a stretch here in the back of your neck, at the base of your skull. You might feel a sensation in your lower neck, and you might feel an activation here in the front of your neck. Now, a good way to do this is whatever you need to do to give yourself a really good double chin. You've got that head pulled backwards, you've got your double chin rocking, and we're just going to hold there. Now, if you can see the camera right now or see the screen, what I don't want is this, and I don't want this. So don't look at the ceiling, don't look at the floor. Think of looking straight ahead. You've just got your head pulled backwards. Keep holding that. Take a deep breath. Relax. Good. Resting position. We'll do that one more time, then we're going to advance it. Shoulders back ever so gently, just to have a, quote, good, solid standing posture. And now head slides straight backwards. Boom. Just like that. Holding there, again, engaging those tissues, engaging that extension, that opening up of those joints in the spine. Take a deep breath. Shoulders relax down. Holding for just about 10 more seconds. Keeping that double chin. A really terrific double chin move. And good, you can release that. Perfect. Now we're going to take that exact same movement and we're just going to add a little bit of an extra movement if you're ready. So what this looks like before we actually begin, you'll do that same position, the same retraction. With that double chin position, now keeping that retraction, what I'll ask us to do is gently rotate side to side. Now what I don't want, so you can get a visual, is this. Do you see how my head and my chin jut forward? Try not to do that. Try to retract, pure rotation. Let's do it together. Comfortable position, shoulders back a bit, double chin, head retraction, and now gently rotate to one side until you feel, new tissue, new muscle, new fascia. You're accessing new ranges of motion for those joints. And one thing joints love and joints need is movement. That's how our joints get nutrition. That's how our joints stay as healthy as they can. So good, you're just gonna keep that double chin and honestly, just as far as you feel you can. You're not going into any crazy extreme ranges of motion and you're avoiding anything that feels like a sharp pain, but you certainly might feel a good, strong stretch is okay. Or the feeling of, there's some stiffness there. Things don't move the way that they used to or that I would like them to. It's great. That's absolutely fine. Just keep gently working through those motions. Let's do a few more to each side and then we'll move on to the next exercise. Good, and I'm going to do one more to the right, one more to the left. Fantastic, you can release all of that. The last exercise I'm going to demonstrate first Before I demonstrate, this one specifically, if you're feeling a pinch or sharpness, just back off of that range of motion. Don't go as far. What this will look like when we do it together is you're going to tilt your head to one side, so you'll side bend. Once you have side bent as far as you can, then you're going to, keeping that side bend, rotate to look up at the ceiling. And when doing this correctly, you'll feel a really nice stretch here in the front of your neck. These muscles are called your scalenes. There's an anterior, middle, and a posterior one. So these scalene muscles get really tight in folks with RA, and so you're going to have a stretch there. If you don't feel a stretch in the front of your neck, you might feel a big stretch over on the side of your neck, and honestly, either one is terrific. Let's try it together. We're going to hold it for about 25 to 30 seconds, once each side. So I'm going to start on my left. My left ear will come down to my left shoulder in a pure side bending motion. Again, there's no pinching. There's no stabbing feeling on this left side, or the side I'm bending towards. Once you have reached the full potential of that side bend, now keep that side bend and gently rotate to look up at the ceiling. Now, if you're doing this correctly, it's going to be really hard to see the screen, so just listen to my words. You're going to feel that stretch either on the side and or the front of your neck. You're avoiding any stabbing feeling over on the side you're bending towards. Now check in with your shoulders. Can you drop your shoulders down and relax them? Good, take a deep breath here. On the exhale, perhaps you can deepen the stretch a little. Find a little more range of motion, a little deeper stretch. Ooh, that feels so nice, opening up the front of that neck. One more breath. And exhale, slowly come out of that position. Now that might feel a little bit vulnerable for your neck. That's a new position for a lot of us. Go nice and gentle. Let's do the other side. I'm going to side bend nice and slow, easy and gentle over to my right side. Again, I'm avoiding any pinching. If you feel any pinching, just back off of that range of motion. Once I've achieved that full side bend, now let's add in that rotation. Looking up at the ceiling, and wherever you feel a stretch, it's great. Shoulders are dropped down. Perhaps you have a gentle smile on your face if you've got a very, very angry face right now. Relax. Stretching feels good. Good, shoulders down. How about a big deep breath? On the exhale, can you tweak that range of motion? Can you find a little more that doesn't feel scary? It doesn't feel dangerous or stabbing. And one more, inhale. Relaxing your eyes. Exhale, dropping your shoulders. Beautiful, coming on out. This is a fantastic routine that I give my patients first thing in the morning. Get those joints moving, get that neck mobile so that way we can continue to build day to day and maintain the motion that we have in our joints. Thank you for watching. My name is Dr. Chad Woodard, and you can find me on all of the social media platforms at Ask Dr. Chad. Thank you for joining me. Keep moving, keep stretching, keep mobility, and keep your function.